May you imagine the African region without any children under 5 years in maybe 50 years because of the climate change? Well, it could be possible. For example, if the salmonellosis is not controlled and monitored, it is due to this diarrheal disease affect drastically children under 5 years, causing chronic dehydration in a few days. Salmonellosis is a common foodborne zoonotic pathogen and is one of 4 key global causes of diarrheal disease. It can be easily spread by eating contaminated meat, milk, poultry, eggs, fruit, vegetable, or drinking water polluted. The bacterium is transmitted through the animal fecal oral route. Its proliferation is exacerbated when there are high temperature, a shortage of water, and poor safety conditions. Aspects that are directly affected by climate change. Due to this situation, the pathogen can modify their environmental survival, proliferation, and development, which can increase their prevalence within the host. To explain the critical impact of this disease, there is a report from the WHO African region which estimated that more than 81 million people fall ill and around 137,000 die each year due to this disease. Between 1990 and 2019, only Western Sub-Saharan Africa registered the highest number of child deaths, which is more than 70,000 cases, and reaches more than 42,000 cases. Those numbers are quite worrying considering that within all regions around the world are more than 49,000 children dies. It could be supported by the idea that some impact of the climate change, such as temperature, humidity, and transpiration level have a direct impact on the planet, changing the relationship between the environmental and ecosystem, and as a result is likely to have the reemergence of infection like salmonellosis, malaria, and Japanese encephalitis. Added to the above, there is additional determinants such as poverty, lack of education, of medical attention to support communities, and poor government policies regarding food safety that significantly influence to this disease. Unfortunately, poor countries are more affected by infection disease evolution due to a lack of monitoring of the symptoms. Despite the impact of climate change that affects the world on the Africa continent, especially in Sahara Africa, the consequence of not having a solid food security policy must be evaluated by government, who must include a priority in basic human rights. This safety measure could be supported by educational, health policy, social sector to protect the wellness of the future. African generation is in our hands and it's our responsibility to make a change, and the time is now.